Welcome to the Banker Lamp. Please enjoy the video.
You begin by confirming the exact product and alcohol percentage. That matters for sensitivity. Next, measure your initial dose, start low, 1 drop in 15 ml water. Once done, sip slowly, hold briefly under the tongue to aid absorption. Make sure to use a clean glass and glass dropper if available. If you are taking other remedies, leave a 10-15 minute gap. Keep a small log of time and dose for the first 48 hours to monitor effects. Once you have your prepared dose, administer it consistently. 1 drop initially, increase to 3 drops only if no adverse reaction occurs. Take the tincture 3 times daily, spacing doses at least 6 hours apart. Pay attention to subtle changes in digestion, energy, or skin, record onset time and intensity. If you notice improvement, maintain the lowest effective dose. If no change after 5-7 days, reassess use and consider consulting a practitioner. Make sure to avoid hot beverages immediately after dosing. To finish a short course, taper down by having frequency over 3-5 days rather than abrupt stop. If you experience oral irritation, nausea, or unusual symptoms, stop immediately and rinse your mouth. Then wait 24 hours and try half the previous dose or discontinue. For persistent or severe reactions, seek medical advice. Make sure to check interactions if you are on thyroid, blood thinning, or diabetes medications. One key troubleshooting.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.